Hi, I'm Dr. Pratisha. I'm a consultant at AAYNA Clinic. Today I'll be talking a little bit about PRP or platelet-rich plasma. It has a very important role to play in regenerative medicine as it is an autologous cellular therapy. So PRP is an FDA-approved therapy for both hair and skin. It's been popularized by a lot of celebrities as the vampire facial. So platelet-rich plasma, how it is prepared is we take about 8 to 10 ml of your own blood. We have different kits for the face and the hair. We have specialized kits which separates the red blood cells, white blood cells and the platelets and the serum. So what we do is we take out the buffy layer which is rich in platelets and along with the serum, and then it is infused into this hair or skin. When it is injected in the hair, what it does it goes to the dermal papilla where there are a lot of stem cells and stimulates it. So after 3 sessions, 1 month apart, we see there's a lot of hair growth. So it activates the dormant hair follicles. So who is not a good candidate for PRP is somebody who has low platelet count, somebody with blood disorders, with chronic liver insufficiency, with heart issues, or somebody who's immunocompromised. Also infections. You must always consult with your healthcare professional whether you're an ideal candidate or not.